Dr. Salemy here in Seattle. We are going to show you our office today. I hope everybody's staying safe out there. It's been now 5 weeks since we've been able to operate. It's been quite a toll on us. We just love to be working, so it's been a little bit challenging. But we've enjoyed giving you guys some more information about our practice and what we do. We thought what we do today is kind of give you a little bit of a tour of the office as well as the operating room, which a lot of people don't get a chance to see until the day of surgery, and give you a sense of what it's like when you come in. So it's the front door of our office right here. You come on in, big heavy door, and have a waiting room that we hopefully don't have too many people waiting in. We don't want folks sitting around here all day kind of waiting for the doctor to show up. We try to keep it pretty efficient so folks aren't waiting a lot. Usually you'll see Brittany's lovely face here. She's our receptionist and front office coordinator, and she'll check you in and kind of get you ready for the clinic. We're going to do two things. I'm going to show you the clinic really quickly, and then we'll come back out and show you how it works when you come to the OR. Whether you're coming in to see us for a new patient visit, a follow-up, or a surgery day, you're always checking in right here. And then we'll take you back this way, and we'll show you kind of how we go. Come back through here, and we have a bunch of exam rooms kind of lined up right here along the way. The exam rooms, we spent a lot of time designing them in such a way that would be really efficient for patients. So let me explain kind of what we thought about. You can't really see it today, but it's because it's kind of cloudy out today, but
the mountain is out there.
It's out there somewhere. Rainier is right out there, so we try to make a nice view for the patients. We wanted it to be big enough so you have room, so you don't feel crowded, especially if you're coming in with a friend or a loved one for your visit. The other thing we did is we made our door as kind of this nice barn door, a sliding barn door, and we did that so we could have more space in the actual office so you didn't feel crowded. In this little closet here, we have a robe for folks to change into. Robe to change into. We spent a lot of time finding the comfy robe. We're told the robes are very comfy, so that's important, not just a little paper robe. And then a nice big mirror with some lights so you can really take a look at everything together. And then when we do our photos, we have our little blue background that we pull down here. And so we have rooms that are all like this so that folks can feel comfortable, feel safe. It's nice and private, and we can take good care of you. And then as we come out, we can show you a little bit of the office here. Oh yeah, everyone loves this. This is actually when we first built this office, my oldest daughter was, was she maybe 4 or 5? And so this was a watercolor. We had her do a watercolor, and then we took one little corner of that watercolor and they blew it up and made a picture. So she loves it every time she comes in. She says, I drew that.
That's her handiwork.
That's her handiwork. And then there's our nurse's station here. Pretty basic stuff. We want it to be clean, well taken care of, efficient. That's the most important thing. We don't want you sitting around waiting to see us all day. If you do have to wait, I always feel really bad about it, but it's usually because I'm in with another patient or operating, but we don't like folks having to sit around too much. So then when we come back this way, I'll show you how it works for your surgery day. So you come in here, you check in, tell Brittany what's going on, and then she'll buzz you around the back. So we have a back door that connects to our operating room. So let me bring you back this way.
If anyone has had surgery here, and we've talked about this gold doorbell, there it is right there.
That's the gold doorbell. I think I hear someone coming out this way.
Oh.
Let me see.
There she is.
She's walking out. You can walk out. It's okay. That's Dr. Sauter. Bye-bye.
Bye.
So we come in through here, and then when you come in here, there's a waiting room right here to the right, and it's just for our surgery patients and their families, so it's very private. And then bathroom for them as well on this side. So this is just for the surgery patients. Waiting room, bathroom, and in this room is the pre-op room. And what we do in here is we have you change. We go over some final instructions. Our nurses meet with you, check you in. Our anesthesiologists meet with you. We do some marking, so we either do the marking standing or kind of sitting up on a bench like this, so I can do the markings for you. We also have another blue background in case we need to take some more photos. we have a camera, a mirror, so you can take a look at the markings and make sure kind of we're on the same page with what we're planning on doing. And of course, back here, more of the really nice comfy robes, because everyone loves the robes.
VIP robes.
The VIP robes. And then once you're ready to go, our nurses bring you back, and let's take you back to kind of the OR. This way. And then we're normally, obviously, we wouldn't go back here without being having our heads covered and out of this coat, but since we're not operating, we can go back and take a look. And then also every night after surgery, we have what's called a terminal clean. So a team comes in, cleans the entire OR and the recovery areas top to bottom, and they do that every night, no matter what. Even if we're not operating, they come in and do it anyway. So we really, really take that seriously. I don't know how the audio is. I don't know if you can hear it, but once we walk through, you should be hearing kind of a hum of the HVAC system. This is really an important part of safety. Our HVAC system is just for our operating room. It's not as part of the whole building. It's just for our operating room. And this is, with all the modern operating rooms, this is a requirement that you have an independent HVAC and that it's working continuously 24/7 every day of the year, no matter what. So it's really important for air circulation and keeping infections down to essentially zero, which is what we have. I don't think we've had an infection in our operating room. Honestly, I can't remember if we've ever had one, frankly. And part of it is because we've taken care of really healthy patients. Part of it is our protocols, but also it's about the infrastructure and the environment. Super clean. And I'm going to show you kind of a cool trick with that. So let's come back here. And then this is the entrance to our operating room, and I'm going to show that in a minute, but I want Olivia to take a look at that. This has got a little green ball, so this is one of my favorite parts of the OR. What that ball is it's showing the air pressure in the operating room. So when that ball is out, that means with all the OR doors closed, there's air being pushed out. So it's called positive pressure. So the air is being blown out, which is what you want for the clean area of your office. So the operating room is positive pressure. This room back here is called our clean room. It has all of our sterile supplies, all of our sterilization equipment, all of our breast implants. That's also positive pressure. And then this room is called the dirty room, which is where all the instruments are cleaned after every case. And that's negative pressure. Not to get too technical, but this is how you want your OR set up with the proper air flow system so that you really maintain a really, really high level of hygiene. Now, we like this little ball here because you know it's working. So let me explain to you what I mean by that. With all the doors closed, the ball is being pushed out, which means the air is being pushed out. Now watch what happens if you look at that ball. When I open the door, see how it moves back in? So it tells us that now that's no longer the case. So when we're operating, the doors are all closed. Then when you go back in, you step in, the door's closed, pops back out. So that tells us you have good airflow the right way. So let's come in and show the OR. One of the things we wanted to do when we built the OR, we wanted it to be really big. We didn't want it to be a small little space. As you can tell, this is really a large operating room for an outpatient surgery center. It's not a tiny little closet that we're trying to operate on. We were not skimping on cost when we came to this building this space. Really quite large, really beautiful lights, top of the line equipment, anesthesia equipment, whatever our anesthesiologist wanted, we got for them. And plus we have a kind of cool view out here. When you first look at this, you say, oh, there's mini blinds. They're usually closed, obviously, during cases, but it's kind of fun to have some light when you need it. But you can see they're actually encased in glass, so there's no blinds to clean, there's no dust, and we have this little knob here that we can use to open them if we need to, just to get some nice light in the room. So you have to close it back up for surgery. So really, really beautiful space to operate. And once your surgery is done, we're going to go right through there. We have this, we show them this big sliding door that we use also to have the recovery bed come in. And again, you can see that that blue ball is pushing outside, it's not in there. And then as soon as we open the door, the pressure should change and it should pop back in. Yeah, there it goes. So then come this way, and this is where your recovery will be. This is where our recovery nurse is going to be with you, doing getting you kind of awake and comfortable after surgery. And most patients spend somewhere between 45 minutes, maybe an hour, give or take here, sometimes a little bit less, sometimes a little bit longer. There's no rush, it just depends on how the individual is doing. And again, I don't know if you can hear it, I'll be quiet for a minute, you can hear the HVAC running. So it's just kind of going 24/7. And then we have another space on this side that's in case you need a little bit longer just to sit in a recliner. We can take you over here and you can just sit over there if you need to for a bit longer before you get home. But this is more or less the space. So big OR, big clinic space, big OR, big recovery space, and we've been really excited about it. It served us really well, and we're excited to get back to operating. Hopefully May 18th, that's what we're hearing, but we'll just wait and follow the governor's directives. In terms of questions, please feel free to pop them up as we're talking. One of the things that we had was we had a question about...
The lighting is terrible.
Oh, sorry. How about that?
Better.
Okay. I will hopefully not fall off of this thing. One of the questions we had was about 3D imaging when we see patients. There's a lot of software out there that allows folks to get a sense of what they're going to look like after surgery, whether it's for breast surgery or rhinoplasty. Those are really common. I've always gone kind of back and forth as to whether or not to have one of those available. I think that the advantage of it obviously is that it's really great for patients to see it. They can get really excited about surgery. Most likely they're going to want to have surgery when they see that. My hesitation has always been I never want to oversell something, and in talking to some people that have these technologies, what they say is that, what they told me is that sometimes it's tough to really stress to the patient that this is just an estimate, it's not a guarantee. And we're all human, we see a picture like that, we're going to say, wow, that's what I'm going to look like, and if you don't, it can be really difficult for patients. And so I try to be a little bit more general in terms of what we think we can achieve. We show before and after photos, they look at our website, they get a sense of what we can do. We size them with implants, for example, when we're doing breast surgery, and that tends to actually be really, really helpful, and patients are almost always really happy with the size. And we have had very few instances over the years where we've needed to go back and change implant size, for example. So I've been really hesitant with it. I can certainly understand if somebody wants that. It's just not something I feel comfortable doing, because it really feels like a promise to the patient. And I just don't think medicine works that way. There's too many factors that go into what a final result will be. But otherwise, we've been doing pretty well during this time off, doing a lot of virtual consults. It's been really fun spending a lot of time with patients talking about what their goals are and what we can do for them. We are going to be raring to go as soon as the state opens back up, and we're going to be excited to take care of all of you. Please keep your questions coming. It'd be interesting to think about what we want to do next week. I'd love to have some topics. If folks have some interesting things they want to talk about, we'd be happy to do that. But we can also just kind of have a bunch of different questions come in and kind of hop between different places. So I hope this tour of the OR was helpful. I hope folks felt like they got a little bit of a behind-the-scenes look as to our space, and we really thanks a lot. And thanks a lot for tuning in.
People hear the humming.
They hear the humming. Good. Okay. It is humming 24/7.
But that's it. No questions.
Great. Thanks, guys. Be safe. See you soon.